How might an overlarge cuff affect your blood pressure reading? A. The reading would be artificially low. B. There would be no significant effect. C. The reading may be unstable. D. The reading would be artificially high. The answer is A. The reading would be artificially low. An overlarge blood pressure cuff will often result in a blood pressure reading that is artificially low. It is important that the nurse chooses the appropriate blood pressure cuff size for each individual patient. While assessing a patient's blood pressure, what part of the stethoscope should be placed against the patient's antecubital fossa, the bell, or the diaphragm? A. The diaphragm. B. The diaphragm should be used first, then the bell. C. The bell. D. The bell should be used first, then the diaphragm. The answer is A. The diaphragm. When taking a patient's blood pressure, the diaphragm alone should be used to listen at the antecubital fossa. The bell, used for low-pitched sounds, would not give the examiner accurate enough information to assess systolic or diastolic pressure. Which of the following would be considered a normal adult blood pressure? A. 124/84 mm of mercury. B. 88/56 mm of mercury. C. 110/72 mm of mercury. D. 132/88 mm of mercury. The answer is C. 110/72 mm of mercury. Normal adult blood pressure is anywhere from 90 to 120 mm of mercury systolic over 60 to 80 mm of mercury diastolic. 120 to 140 mm of mercury over 80 to 90 mm of mercury would be considered prehypertension, while anything over that would be considered either stage I or stage 2 hypertension. What is a normal respiratory rate for a child aged 1 to 6 years old? A. 34 to 44 breaths per minute. B. 12 to 24 breaths per minute. C. 36 to 54 breaths per minute. D. 24 to 34 breaths per minute. The answer is D. 24 to 34 breaths per minute. A normal respiratory rate in a child aged 1 to 6 years is 24 to 34 breaths per minute. This is significantly higher than an adult normal respiratory rate, which is 12 to 20 breaths per minute. What is a normal heart rate for an infant under 1 year old in beats per minute, BPM? A. 160 to 240 BPM. B. 100 to 160 BPM. C. 60 to 100 BPM. D. 30 to 60 BPM. The answer is B. 100 to 160 BPM. Infants have the highest heart rate of any age group. Normal heart rate for an infant under 1 year of age is 100 to 160 BPM.